A tumor that doesn't actually have any blood vessels cannot grow any bigger than the head of a ballpoint pen. But the moment blood vessels can touch that little tiny microscopic tumor and start to feed it, a cancer will grow 16,000 times in 2 weeks. And studies have shown just eating even one overnight will start to change your gut microbiome, favoring more healthy species of bacteria. Cancer cells avidly use glucose to fuel their own metabolism. Our bodies are able to take any glucose and take it down to a sub-threshold that wouldn't drive that cancer cell any faster than it would a normal cell. If you've got diabetes, it's a different situation. And so if you wanted to be safer, you might want to stay away from cancer, like sharks. When they're on the cover of a magazine, it sells. They fly off the shelf because people are interested in this topic. And just like sharks, there's a lot of fear and reaction, I think, to the topic of cancer. And I think this is also true even in the medical community. So, first of all, let me kind of give my response to what we do know about the evidence of sugar and cancer, because I do cancer research. I've been involved with cancer research. I've been involved with helping to develop over a dozen cancer drugs that are FDA approved. And part of my street cred, Drew, when I speak about food as medicine, is that I've actually helped to develop medicines. I'm one of the guys who actually, I'm not just sort of like waving a leaf of kale saying, never mind all the prescription stuff. Like, I'm actually helping to develop those things. So for me, it's really, food is really an additional tool in the toolbox, but we can understand nutrition with the same rigor, with the same standards of evidence that we actually apply for drugs. So here's what we know about cancer. We know that we no longer talk about cancer just in terms of the organ it's in. The modern conversation about cancer in the medical community isn't, it's a colon cancer, so it's a colon disease, and it's a brain cancer, it's a brain disease, it's a breast cancer, it's a breast disease. We're actually talking about at the microscopic level that cancer has a microenvironment. It lives in a microenvironment. So just like if you had fish in a fish tank, what's going on around the fish in your tank actually makes a big difference in terms of how well the fish actually thrives. And so cancer, think about cancer being like in an aquarium, and that aquarium being kind of miniaturized in our body. There's a microenvironment. There's a little mini terrarium or aquarium around every tumor, every cancer cell. And so among the most sophisticated cancer researchers, and I count myself in that group, we now refer to cancer as very much due to related to cancer cells and the microenvironment. And where sugar comes in, along with other micronutrients in the microenvironment that feed both normal and healthy cells, is the fact that glucose is uptaken by every single cell in the body. But because cancer cells are revved up, they are able to actually take that nutrient and actually fuel themselves. So what started as sort of like a well-intentioned interpretation by a non-medical profession has now been really validated, I think, by the cancer research world. Now, because sugar itself sort of quickly goes to stuff you would add to your drinks or your desserts, it all of a sudden becomes kind of a flip topic. But in reality, I think that it's incontrovertible that to cancer researchers that cancer cells avidly use glucose to fuel their own metabolism. So here's where things get more sophisticated. In a typical person, let's say you or I, or someone watching this podcast who doesn't have diabetes, our bodies are able to take any glucose that we introduce by our diet and take it down to a sub-threshold that wouldn't drive that cancer cell any faster than it would a normal cell. So in other words, our endocrine system, our body's own ability to process glucose pretty much takes anything that we introduce in our stomach. And although there might be a quick spike, we'll take it back down within a few minutes. If you've got diabetes, it's a different situation because your hyperglycemic microenvironment that your whole body represents is probably contributing to the growth of that cancer to begin with. And so if you wanted to be safer, if you had cancer, struggling with cancer, and even if your body's ability to process sugar is fine, you might want to kind of stay away from added sugars if you can. But then this is where it gets even trickier. People say, well, then I'm not going to have fruits because fruits are sweet. And fructose is turned into glucose in the body. Again, this is the slippery slope where people who are not biochemists, who are not research scientists, get into that realm where they can talk about the topic and make themselves more confused. I will tell you that although there is natural fruit sugars in a piece of fruit, the reality is when you eat a piece of fruit, an apple, a pear, a peach, something sweet, a grape, you are getting a lot more than the fructose in your body. You're getting fiber, you're getting polyphenols, you're getting all these other micronutrients, many of which can actually fight the cancer itself. And so food as medicine isn't a pill where you got good guys and bad guys and cyanide pills and cure-alls and magic bullets. It's really, food is really a complex mix. And what we're really finding when you look at the evidence, again, evidence being really important, is that by and large, plant-based foods, even ones that have some natural sugars in them, actually help reduce the risk of cancer. Although many people, myself included, have spent years, decades, doing drug development where we figure out a problem in the body and we try to figure out a targeted therapy, like a smart bomb to hit it. This is billions of dollars. It takes a decade or more to develop a single drug. The reality is, and I've come to this conclusion after, having been involved with drug development for 20 some years, is that we are not smarter than Mother Nature. Humans just can't outwit the cleverness of Mother Nature. So most of these foods that are we now know are good for us, most of them are plant-based, are enriched with not one, and not 10, but hundreds, if not thousands of different compounds, most of which we haven't discovered yet, that when we actually do study them, they wind up helping our body activate our body's health defense systems so that we can actually better resist disease. If you don't have enough blood vessels, your cells, your organs, your tissues are going to die. How do we know this? Well, if you've got a disease like diabetes that hammers on angiogenesis since you can't grow blood vessels very well, you get a wound in your leg, it's not going to heal very well. It's called a diabetic ulcer, leads to amputation. It's really a bad problem. If you're older, if you've got high cholesterol, you've got diabetes, and you have a heart attack, your heart is not going to grow blood vessels to repair itself very easily. And so basically people die because you don't have enough blood vessels to supply tissues that are in jeopardy. Same thing as a stroke. So we know angiogenesis is critical, and our body defends itself by growing just the right amount. What is the right amount? Well, it's not too few and not too much. It's just the right amount. I call it the Goldilocks zone. So remember Goldilocks? The bears are like not too hard, not too soft, just right, not too hot, not too cold, just right. So the body knows how to do this with most of the systems that have been hardwired into us to defend ourselves. And so you get just enough blood vessels, and then there's kind of like a zone where more can grow. Not too many. If you get too many blood vessels, you also get into trouble. You get too many blood vessels growing your eye, for example. Those blood vessels leak. You get blood coming out. That causes blindness. Diabetic blindness is due to extra blood vessels, excessive pathological angiogenesis growing in the back of the eye. You can go blind. Same thing when older people say, I'm losing my vision. It's usually macular degeneration. That's where blood vessels are growing in the back of the eye and leaking and causing all kinds of problems. So too much angiogenesis is also a problem. So how does the body normally prevent having too much angiogenesis? It's got all these systems to be able to mow the lawn. So think about a landscaper that's trying to create like the perfect lawn in the front yard, right? So basically, if the lawn overgrows, you got to get the landscaper to come in and mow it back down to exactly the right height. That's what the body knows how to do when it comes to our blood supply. Now, cancers are forming all the time. So right here, right now, my body and yours and everybody watching this podcast, we're forming little microscopic cancers in our body right now. Why? Because we got 40 some trillion cells that are dividing, making more cells all the time. You make one or two mistakes in those cells, bingo, you got a tiny little microscopic cancer like a pimple. And like a pimple, it's harmless because it doesn't have a blood supply. So then your immune system wings by, finds it, and cleans it right out. It's like, or your immune system's like a cop on a beat, okay? And it'll take the bad guy right out. However, cancers can become dangerous when they are able to hijack our angiogenesis system. So this is really part of the nefarious, dirty deeds of cancer. They can be harmless and sit in the background in our bodies all the time, anytime. But if they find a way to leak proteins called growth factors that act like fertilizer, and they hijack our lawn, that turf that we're trying to grow, and they grow blood vessels into themselves. And I've done research on this. A tumor that doesn't actually have any blood vessels cannot grow any bigger than the head of a ballpoint pen, the little ballpoint thing. That's it. And it can't get any bigger. It doesn't have enough oxygen, no nutrients. So it's stuck. But the moment blood vessels can touch that little tiny microscopic tumor and start to feed it, a cancer that is the size of a tip of a ballpoint pen will grow 16,000 times in 2 weeks. So this is an explosive trigger when angiogenesis is hijacked and our body isn't able to control it. So that's called tumor angiogenesis. And that's how I got started in this field, because we were at the beginning trying to set out to figure out, how do you develop biotech drugs that can starve a cancer by cutting off its blood supply? Well, we've done that. And it's actually one of the mainstays of cancer treatment today. But the more exciting thing, we found that when you use the same testing methods that were used to develop these drugs to test foods, there's more than 100 foods that can actually starve cancers as well. Way back when I got in this field, we had a test system where we were testing cancer drugs that could starve a cancer by cutting off its blood supply. And one of the things that I did is I actually dropped some green tea in there, and it was shocking how effective the green tea polyphenols were in stopping those blood vessels that were feeding the cancer. And in fact, if I didn't tell the technician doing the lab work that it was actually a natural compound, and I told them it came from a drug company, they would have been super excited about it and started jumping up and down. And so again, Mother Nature is really, really good. So polyphenols in tea, e.g. CG is one of them. Resveratrol in red wine, also another one that's actually really, really powerful in terms of being anti-angiogenic. Genistein, the phytoestrogen in soy, actually can also cut off the blood supply feeding breast cancer. So it's just the opposite of the urban legend out there that soy is not good for you. I recently saw an article. It was a cover of a magazine that said, soy anti-nutrients or something like that. And my mind was blown that somebody could actually say that, because most of the nutrients, including the proteins, but also the phytoestrogens in soy, again, if you're a scientist, you take a look at this, and the phytoestrogens look nothing like human estrogens. They're not dangerous. They actually block human estrogens, and they actually are also anti-angiogenic, and they cut off the blood supply to breast cancers. And this has been shown in human patients, breast cancer patients as well. Tomatoes have lycopene. So many of the same foods that we know are good, healthy, plant-based sources of nutrition, we're now rediscovering that many of the bioactives in them are also powerful cancer blood vessel cutting off systems that cut off that starve a tumor. So blueberries are blue because they contain a natural dye that is colored blue that is called anthocyanin. And anthocyanins have been found to be powerful activators of our immune system in a beneficial way. So they don't cause autoimmune disease. They actually elevate our T cells and natural killer cells. These are part of the super soldiers that make up our immune system. They just kind of like give more weapons to our immune system to defend against invading armies. And just by eating like a cup and a half of blueberries a day, you can elevate your T cells by like 88%. Okay. And athletes that actually eat blueberries regularly, they just walk around with a higher level of immunity to begin with. It's kind of a performance maintainer, not an enhancer. It's a maintainer because your immune system is also firing at peak. Now, what's also interesting is that the same anthocyanin lowers inflammation. So this is a classic dilemma that is out there in the wellness world. Like, yeah, we want to get rid of inflammation, so we want to make sure our immune system isn't overactive. Well, look, inflammation is a subset of immunity. We want good, strong immunity to protect us from invaders, and we want to also lower inflammation at the same time. Blueberries can actually do that. Another great way of actually elevating immunity is with broccoli. Now, broccoli contains a natural compound called sulforaphane. It's actually a family of different natural chemicals that kind of give broccoli its kind of unique taste. It's also in kale, chard, all these other kinds of salad vegetables, honestly. But broccoli is particularly strong in. And it's been shown that actually you can actually boost your T cells, again, the super soldiers of your immune system, by just eating broccoli. But here's like a little pro tip and a little tiny hack. If you want to get as much as you can out of broccoli, you should eat normal adult broccoli. But here's the thing: the treetops are good, but the stems have twice as much of the sulforaphane. So don't throw the stems away when you're cooking it. If you don't want to saute the stems, there's plenty of recipes you can use with stems. You can put it into a blender, turn it into a soup, a little broccoli oregano soup. Amazing. Put a little vegetable stock in there. It's like a really tasty way of actually using broccoli and getting more of these sulforaphanes. But if you really want to like rock it with your broccoli sulforaphanes, you eat broccoli sprouts. These are the 3 to 4 day old baby broccoli. And it turns out that the broccoli sprouts have 100 times more sulforaphane than the grown-up broccoli. So, and actually, the study's been done looking at the people getting the flu vaccine. These are 20-year-olds, healthy 20-year-olds, just getting the flu vaccine. And it was found that if you gave the flu vaccine and gave somebody broccoli, a shake made out of broccoli sprouts, you could ramp up their immune response by 22 times. So, like, really just amp up your immune system without causing inflammation. I'm like most people, I think. When you tell me not to do something, my brain goes, well, maybe I'll do it one more time. Maybe I'll try it. And so there's a lot of human nature to how we respond when somebody says something to take something away from you. And human nature abhors deprivation. And so one of the things is, I think most of us like to have our, quote, cake and eat it too. And so I always felt when I was, taking care of patients and trying to counsel them on things, rather than tell them to remove things from their diet, because that's really easy to do. And there's plenty of people out there, scolding people. Fear, guilt, and shame is sort of like the building blocks of traditional counseling about nutrition. And makes you feel bad, actually, when somebody tells you, like you're a bad person for eating junky food. What I try to do is empower people, because I think people love to feel justified in what they like. And so in my book, I read about 200 foods that all activate the body's health defenses. And I used to say, I dare you to find in this 200 foods something like that. I dare you to find, review this foods and tell me that there's nothing that you like. And most people actually find something in 200 foods that they actually like. And I say, well, look, start with this, because what you like is already good for you. So you're already way ahead of the game. And if you can keep on adding things that you like and just understand, this is that education knowledge piece, what you like is good for you, then you can love your food and love your health at exactly the same time. And then this whole idea of anti-deprivation is that if you spend more time thinking about what to add to your body that's good for you, you'll spend less time thinking about the bad stuff, and more good things in your body kind of push out room for bad things. And if you spend most of your time fortifying your body's health defenses, those 5 health defenses, angiogenesis, stem cells, microbiome, DNA protection, and immunity with foods, honestly, every now and then you can fall off the wagon. You can eat something you really like, or you really want to, or, everybody's eating it around you, and it's not that good for you. That's all right. Your body's got you covered. Your health defenses are there as a shield. So again, I think that there's just a healthier way to navigate through your life. These strict diets don't work for a long time. They're unsustainable. So I'm all about how do you actually get people to feel like they're in control, and what they like to do already is actually good for them. Kiwis, right? So these sort of, baseball shaped, little smaller baseball, furry little brown things. You cut them open, they're beautiful and green with seeds, starburst on the inside. I always liked kiwi, but I never really ate them very much. But I started doing the research on them, and kiwi is pretty amazing. First of all, it's a great source of vitamin C and fiber. And the vitamin C actually has tremendous antioxidant effect, and it can protect your DNA. And studies have been shown that actually, if you eat 1 kiwi a day, it'll protect your DNA against damage by about 60%. if we ate 3 kiwis, it would actually help your body build any damaged DNA back by about 60%. And so here's something simple that you can peel, cut up, chop it into a yogurt, or just eat plain. It's delicious. You can put it into a smoothie that actually has this amazing ability to actually protect your genetic material. Like, that's so fundamental, and it tastes great and not too sweet, and it's got a little citrusy flavor. Then the other thing that's great about kiwi is that it's packed with fiber. Now, fiber is basically, a kiwi is essentially a prebiotic food. Its fiber feeds our gut microbiome. And studies have shown, there's a study done in Singapore that showed that just eating a kiwi, even 1 kiwi, overnight will start to change your gut microbiome, favoring more healthy species of bacteria. And so, like I always tell people, like, if I tell you something like that and you try a kiwi, you can't unlearn what I just told you. Every time you see the kiwi, you're going to say, you know what, I know there's something good about it. And then if you remember what that is, that's really what I try to do with my course, is really try to teach people how to make it second nature to make great choices. I learned about Akkermansia because one of my colleagues, Dr. Laurence Zitvogel in Paris, was studying cancer patients. So we're back to cancer again. And she was studying like 200 cancer patients with different types of cancers. And they were all being treated for their cancer using immunotherapy. So these are the treatments that are biotech given to cancer patients. The treatments don't kill cancer cells directly, but what the treatments do is they rip the cloak off of the cancer that's trying to hide from your own immune system to allow your own immune system to tackle that cancer. Remember that health defense property of our immune system to fight the bad guys inside our body. And we know from immune therapy as doctors that, they can be an amazing win, meaning that some cancer patients are able to literally have their cancers completely disappear, even if it's metastatic cancer. My mother was one of those people, but former President Jimmy Carter was another one who had metastatic cancer. It spread to his brain on immunotherapy, all went away, all doing well today. No sign of cancer. We don't like to use the word cure because it is such a loaded word, but it's about as good as you can get from as a doctor and someone involved with biotech. But that only happens in less than 20% of people, right? And so Dr. Zitvogel was doing this research. I helped to convene a conference called Rethinking Cancer. Like, how do we rethink our whole approach to cancer? Kind of a fresh start. And she found that in 200 consecutive patients with different types of cancers, all getting immune therapy, if you split them up into groups that responded and did really, really well with their immunotherapy, had their immune system, attack and wipe out the cancer, versus the people who didn't do well, where their body didn't respond the right way, the only difference between the responders and the non-responders was one bacteria in their gut. And that one bacteria was Akkermansia. And it's Akkermansia muciniphila. That muciniphila actually says it all. This bacteria, which is considered now to be a guardian of our microbiome, it's one of the guardians of our health, loves to grow in the mucous membrane, in the mucus inside our gut. So our gut, actually, most people don't know this, but actually our gut has mucus. You know this if you have diarrhea, it's very mucousy, but there's some mucus in there all the time. And that mucus is sort of like topsoil for Akkermansia. Loves to grow in there. That's the guardian of the Akkermansia, where this guardian bacteria loves to grow. So if you take antibiotics, you can wipe out your Akkermansia like that. Okay, and then you got to grow it back. And so what she was finding is that people who were not responding to the immune therapies, you need a good immune system, that they were missing their Akkermansia. And many of them had been taking antibiotics, as a matter of course. As a cancer patient, you might get sick. Man, you take like a Z-Pak, man, you wiped out your Akkermansia. Now you got to grow it back. So this was like a brand new discovery. It was published in the journal Science. For me, when I saw that, and I saw it before, when it was embargoed, I saw the original data. It, like, the light bulb just like went blazing in my brain, like, holy cow, we have got these guardians in our microbiome that we have to take care of. And the reason that I got involved in this food as medicine is that you cannot eat an Akkermansia probiotic. So you can eat a lot of other bacteria and probiotics. You cannot eat Akkermansia. The only thing you can do with Akkermansia right now is to grow it yourself. This is a DIY kind of bacteria. And the way you grow it is actually by creating more healthy mucus, that topsoil that it likes to grow in. So, how do you do that? You do that with food as medicine. So, pomegranate, cranberry, Concord grape, the juices. You only need 8 ounces of a glass of cranberry juice, pomegranate juice, and you'll be able to actually grow back this Akkermansia. I had a cancer patient, by the way. This was a couple of years ago, who had multiple myeloma, was going to get an immunotherapy, and her doctor was really gung ho to get her immunotherapy, her oncologist, and her kids had a cold, so she had got a bronchitis and got a Z-Pack. Okay, and so before we started this immunotherapy, I basically said, let's check your stool. Sent out her stool for Akkermansia, 0, which
Wow.
you would expect from the Z-Pack, okay, and the antibiotic. And so I said, no, let's put the brakes on here. So we skidded to a halt before actually giving her the immunotherapy. I'm like, we do not want to waste this shot on goal. Like, this is her shot. And so I gave her cranberry juice and pomegranate juice. And we had her drink for 3 weeks straight every single day. And then we tested at the end of 3 weeks. So we delayed her treatment for 3 weeks. When we tested her stool again, she had 6 times above the average population of Akkermansia. So she really killed it and got a ton of Akkermansia. She got on her immunotherapy, and within 3 treatments, she responded to the upper 1% of responders. So she was like super responder and just completely recovered from her cancer, like completely wiped it out. And again, this is sort of me learning from research that had been done and published in research and evidence, thinking about how food fits into it, and actually using our body's own defenses to really help itself. This was not food versus medicine. This was food and medicine. And I think that's something I want your viewers to really take away from. Like, we're really not talking about food versus medicine. Like, we're way beyond that. Honestly, you can still have that battle, but it really is about this totality. We want to be able to figure out how to use all the tools in our disposal to be able to win this battle, which is called our life as we journey through it. And if we can enjoy ourselves with food along the way, that's really having our cake and eat it too. Hey, if you like that video, then you're going to love this one. Check it out.